Hello, and you're welcome to Carlow Mental Health Association's interview this morning with Sarah Hearne. Sarah is the HSE's Regional Officer for Suicide Prevention for the South East, and we're having a chat with Sarah today just to highlight World Suicide Prevention Day, which happens every year on September 10th. So I suppose just to introduce Sarah, Sarah's role is involved with working with community groups and really promoting the whole area of awareness and prevention around suicide prevention and suicide awareness. And to put it in context, I suppose Sarah has given me figures here for suicides in the country over the last number of years from 2017 to 23. And I suppose we're talking about anything between 350 and 450 deaths by suicide per year. And while that's only a figure in one sense, it's a big figure, and it's a figure of tragedy and huge loss for those number of families. And it's a story of sadness and torment and distress for those individuals who saw no other option only to end their lives. So I think it's something that we need to be more aware of. And I appreciate you taking the time to speak with Carlow Mental Health this morning, Sarah. So Sarah, welcome. And if you want to tell us a little bit about your role as Suicide Resource Officer.
Good morning, Rita. Thank you so much for having me, and I'm delighted to have this opportunity to highlight the role and the work in the area of suicide prevention. As you mentioned, World Suicide Prevention Day is coming up on the 10th, and I just mentioned before I go into the role, the theme for 2024, and it's changing the narrative on suicide with a call to action to start the conversation, which is what we're having today. And you know, the suicide can affect every one of us. And World Suicide Prevention Day reminds us that by raising awareness, reducing the stigma and encouraging action, we can help to reduce the instance of suicide. So it really, changing narrative really starts with us. So reaching out to a family member, a friend, a colleague, or even a stranger can change the course of another person's life. So I suppose, you know, all of us can play a role no matter how small, and we never know what action makes a difference. But we all have the ability to reach in and ask someone how they're doing. So I think, you know, so World Suicide Prevention Day, I suppose it acts as an opportunity, again, to remind us, you know, to start the conversations. We can break down the barriers by raising awareness, and that every conversation, no matter how small, matters.
That's important, Sarah, because it's not, there's probably a fear of addressing the issue of suicide or talking about suicide, that old notion that if you don't talk about it, it won't happen. There's still a little bit of that there, is there? Or is it?
Absolutely. I think, you know, conversations around mental health are improving, and I think we're getting more comfortable in that space, but that stigma is still there. So we still, I suppose, need these campaigns and awareness days just help us, I suppose, to bring it to the forefront again, and in some way break down those barriers or the stigma. And that ties in very much, you know, and is reflected within our national strategy to reduce suicide, which is Connecting for Life. And I suppose that's very much where our role comes in. So as you mentioned.
Can you just tell me a little bit about your role, Sarah? You know, what's your day-to-day job? What does your job involve?
So we work, as I said, I suppose we're leading out on the development, the coordination of Connecting for Life, but at local level. So we have a national strategy, and our role is to work in partnership with voluntary, community, statutory agencies to, I suppose, progress the actions within Connecting for Life. So we very much work in the area of suicide prevention, intervention, and suicide bereavement, the post-vention supports. So it's really about supporting organisations who are working with priority groups and those vulnerable to suicide and self-harm. So we do this really through our relationships, through providing information, guidance and advice and signposts and supports. So it's really helped to ensure that best practice is followed across the community in relation to aspects, you know, around suicidal behaviour and the responses. So we raise awareness of local and national support services, what's available. We do this by, you know, developing resources and leaflets and things like that, everything we can to kind of promote what is there, signposts, so that and increase help seeking behaviour. We also promote, the mental health, the key kind of mental health messages campaigns that are happening at national level. But our role is really to, I suppose, align with this, bring people together and coordinate kind of responses that are happening on the ground. There's so much good work happening, like from yourselves, Carlow Mental Health Association, doing magnificent mental health promotion messaging. And I suppose our role is more kind of in one step back from that, but it's about knowing what's happening across 5 counties. So our work is across the region. So we work in Carlow, Kilkenny, South Tip, Waterford and Wexford. So I suppose we're that link sometimes as well to kind of highlight the best practice that happened in one area and maybe repeat that or support it to happen in other areas and developing initiatives around that.
And I suppose even in the work we do as well, Sarah, it's great to see, as you say, it's about implementing the national strategy at local level, but our GAA clubs, our women's groups, our men's groups, our community, every group seems to be kind of taking on the mental health agenda at this stage, which is brilliant. As you said, the conversations are happening. So it's to bring the whole suicide conversation into that local level as well, so that people know it's okay to talk about it and know that really talking about it is the only way to bring it forward.
Yeah, that's it, exactly. And and often through those relationships, and we have some structures in place, I won't go into that, but we have groups that meet, at local, regional, and then we have that link with the national. So where there's issues identified or emerging needs, we can highlight them and hopefully work together and develop initiatives to respond. But also, as you mentioned, the likes of the GAs and many different community and voluntary groups are the first point of contact often and have the relationships on the ground. So our role is supporting them. In the very, very tragic, difficult circumstance of death by suicide, we will support those groups to respond. So that might mean a very specific response where we go in and meet with them and provide information and, support them. But then it's often a cascade effect where they will then, particularly where young people are involved, they will then support the young people through the relationships that they have. There's, I suppose, in other circumstances where there's a sense of overwhelm or, sometimes that fear arises and there can be an overwhelm in the community. Our role is to coordinate a community response in the aftermath of
I suppose part of your role then, Sarah, will you tell us a little bit about, maybe before an incident happens and the training you can offer in terms of the prevention or the awareness piece? You do deliver specific trainings around suicide awareness.
We do, thanks, Rita. Yeah, so we provide, I suppose, a wide suite of trainings to reach a wide range of audiences. There's a newly developed online program which is very accessible to all. It's an hour long and it's online and it's developed in Ireland by the HSE, by the National Office for Suicide Prevention. So we'll signpost to that. And there's, I suppose, for World Suicide Prevention Day, there's a big campaign now happening where we're trying to encourage as many people as possible to engage with that online program. But in addition to that, I suppose you can go at different levels. So we have Safe Talk, which is community-based suicide alertness training program, and that prepares people to, I suppose, to be suicide alert helpers. So it's that first step in terms of understanding suicide, becoming more comfortable with asking the question and connecting with what supports are available. If you want to go on then further, we have, kind of skills-based training and intervention. We have the ASSIST, so which is applied suicide intervention skills. And that's a 2-day interactive workshop, which is designed, for people to recognize when a person is in suicidal distress, understand their needs, use a language to kind of reach in and empower the person in distress, and then I suppose bring them, help them to keep themselves safe.
There's a level there for whether it's somebody in the community or a professional. There's a level there for everybody, Sarah, to
yeah.
Meaning.
Yeah, and I suppose, yeah, people are comfortable at different stages. They might go to the Safe Talk, and then at another point in time, they might feel that their role or their life circumstances, they require more in-depth knowledge or on a day-to-day basis engaging with people who are distressed at that level. Whereas the suicide, I suppose the safe talk is for anybody in the community at any point, because sometimes we might be, it's about, I suppose it's about empowering us. So it's, we can invite people to, I suppose, engage in the training so that sometimes we're concerned about someone, or we might have said, oh, I would have liked to have maybe checked in with that person, but I wasn't sure how. This gives you the
It
tools.
takes the fear out of having that conversation, doesn't it? If we feel we've some little bit of awareness or skill in it, we might be more inclined to engage in that conversation. And as you said at the beginning, it's often that conversation that can be life-changing, so
Absolutely.
I suppose that's the prevention piece, Sarah.
Yeah. I'll
And you
just mention, sorry, Rita, I'll just mention, we also have Understanding Self-Harm, a one-day program in that, and that can be very good for professionals, but also parents, who want to know more around that topic. And also we have the Suicide Bereavement one-day workshop, which is for professionals who come into contact with those who are bereaved by suicide. So that really looks at grief and loss, but in the context of suicide. So just that people know that those training programs are available, and that you can go to our Bookwen page. So it's www.bookwen.com/SRO. I'm sure we can share the links, but that page has all the trainings on it.
Brilliant. Yeah. And you mentioned the self-harm piece, Sarah, that I kind of wouldn't automatically have thought of, but I suppose it's a big indicator of increased risk, somebody who does engage in self-harm. So it's important to be aware of that as well.
Yeah, very much. So, yeah.
And you've mentioned there the post-suicide, where you work with communities, and also the bereavement support. Tell us a little bit about what you do in that space, Sarah.
Yeah, so I suppose we as I said, we can provide support. We will meet, we will, we'll initially, we might get a phone call, we'll talk through what the needs are, what's presenting, and then support those organizations to respond. And that might mean that we will come in and go, and provide a community response, looking at grief and loss support, and having a holding space and providing information and signposting. But then I suppose there's another stage where there's a sense of overwhelm or a risk of contagion, that we would provide a coordinated response. And we have guidelines which kind of give us a roadmap to that. And that's really about a multi-agency response. So then I suppose the key in all this is what different partners and organizations are there, and who do we signpost to. So if you'd like, I can talk about those there.
Yeah, just briefly, what organizations can help or support in those situations, Sarah, please.
Yeah. So we have the Suicide Bereavement Liaison Service, and this is a free service, and it's funded by the HSC, National Office for Suicide Prevention, and it's run and managed by Pieta here in the southeast. So it's I suppose a one-person post across the region, and they offer guidance, information, practical and emotional support immediately after suicide, but also at any stage when a person feels the need to talk to someone, about this very difficult experience. And it's available regardless of when the death has taken place. And it's a one-to-one, it's tailor-made, so it's one-to-one or family support sessions in the home or any place that the person feels comfortable. So I suppose that's the initial signposting service. The suicide.
That's a great service. This bereavement liaison officer can actually come into the person's home to meet with one individual or family, because I can only imagine in a situation like that, people maybe are not able to bring themselves to a service, or it can be difficult to come forward to look for help. That the fact that this person can come to the home is a huge benefit.
Yeah, and often, that's where the person feels most comfortable, where they're not in a position to reach out or go to another service. But it's also sometimes our natural supports and those around us are very much in the early days there, but we sometimes might need someone outside of that to kind of really talk about what's happening and how it's impacted. So the SBLO is a good starting point. Following on from that, then I suppose sometimes sometimes there's the need for counselling, depending on the level of distress and the needs of the person. So we have the HSE bereavement counselling service for traumatic deaths. So this is provided across the 5 counties that I mentioned, including Carlow. And I suppose it's for traumatic death. So it's for those aged 16 and over that are bereaved by suicide, but also homicide, road traffic accidents, industrial, domestic and agricultural accidents or drowning. So, and it's whether it happened, the death has occurred recently or in the past. So this service is, I suppose it's provided by experienced and fully accredited counsellors. It's free, as I mentioned. There's no need for a medical card, and referral is very straightforward. The referral form through a healthcare professional like the GP. But if we'd always say phone us or email us, and we'll support you and talk you through the referrals. But we try to make it as easy as possible to access the service.
Okay, Sarah, that's brilliant. I suppose I've learned more this morning, and through my role with Carlow Mental Health Association, I suppose I like to think I know what's happening or what's available out there, and I know of your position and your role, but there's lots happening there that I wasn't aware of even that counselling. So it's brilliant, and thank you for I'm conscious we just can't keep this short to try and keep people's interest. But I suppose it's been a great opportunity to have the conversation around suicide, and to acknowledge that you said it in the beginning, it's not something that happens out there in the world. It's something that can happen to any of us, that can come to any of our door at any stage if life throws those circumstances at us. It's not something that any of us can be immune from. Sarah, thank you so much for taking the time. We will put up your contact details at the end of this short clip. And also feel free to have a look at the Carlow Mental Health Association website, our Facebook page, or our help and support booklet, which is available on our website as well, where you will get contact details for Sarah in her role as Resource Officer for Suicide Prevention, and other supports that are available for people in distress. Sarah, it was lovely chatting to you this morning, and thank you very much for taking the time.
Thank you, Rita.
Thank you.